the safest sleeping position for your baby. My name is Dr. Carly, also known as Professor Caroline Fertelman, and I have over 30 years experience working in the NHS. The most important thing you can do for your baby is to lay them flat on their back in a clear, separate sleeping space. So they're best in a Moses basket if they're little, or a cot maybe attached to the side of your bed. That's the safest position for them to be sleeping in. If you're putting them to sleep with blankets, make sure that their feet are right at the bottom so that when you put the cover on them, they don't wriggle, they can't wriggle underneath because they're already at the bottom of the cot. And that stops any covers getting close to their face. So on their back, and the sudden infant death syndrome or cot death has really been shown to be reduced hugely since the Back to Sleep campaign. So do not put your baby on their tummy and do not put your baby on their side. It may be you have been told by other people like your parents that you were on your front, but the evidence is really clear that since the Back to Sleep campaign, the numbers of babies dying from cot death has dramatically reduced. So that's a very important lesson. I think the other thing, besides the position that your baby's in, you keep the cot nice and flat and nice and firm. You don't incline it. And a question I often get asked is what happens when they roll on their tummy? Now, some people might say, well, roll them back, but I think you can't spend all night watching and worrying them. What we do know is that most babies, unfortunately, who do die from cot death or sudden unexplained death in infancy, or SIDS, sudden infant death syndrome, are less than 3 months old, so they're not rolling yet. So once a baby is rolling, then I think it's fine to leave them because they've rolled onto from their back onto their front, which is actually the harder way to roll, and they will be able to easily roll them on their back. So I don't think you should be standing up all night peering at them and then quickly flipping them over every time, maybe the first couple of times, but once the babies are able to roll, their chances of cot death really does go down dramatically. The other babies you need to be particularly careful about are the babies who are very little, and also the babies who were born prematurely. In terms of the position, if you're having them in your bed with you, there are some really important things to note about bed sharing, namely do not bed share if you smoke, if they were premature or small, if you've taken any drugs, either prescribed or otherwise, which might make you drowsy. Those are all reasons not to be sharing your bed with a baby, and certainly not if you've got pets in the bed or other children in the bed. Those are again reasons to be keeping your baby nice and flat on a clear separate surface. You don't want to use positioners to keep your baby on their back because they can get all caught up in that. So these are some of the things that are important about the position of your babies. Flat on their backs, always. You may have been advised otherwise, in which case you need to obviously listen to the medical advice you've been given. And also there are some babies who've been in special care baby units who are used to sleeping on their front, but most units will actually flip them onto their back before you go home with them. So the one thing you need to remember from this video is always put your baby to sleep on their back. Once they roll over, then these rules don't really apply. If you found this video helpful and useful, please do subscribe to my channel and do follow me and let your friends know.